everybody. This is Cindy. I'm doing a live from the brand new location of Woods Center in Hamilton, New Jersey, which is down about 20 minutes from Princeton, I think. It's like South Jersey. And we are here with Ethan, who's going to give us a tour. If you follow my podcast, we already talked to a couple people from the Woods location in Pennsylvania. And then a few months ago, we interviewed Dr. Kolesk, who was talking about this location, that it was going to open in August. And here it is August, and we're here for the tour. So I'm going to flip my camera around, and we're going to start with showing you where to park, because there's a lot of buildings here at this hospital. It's Robert Wood Johnson Hospital in Hamilton already. And when you first get here, you're going to want to park in parking lot D. That's where we park. That's the first thing you need to know, because there's a lot of different buildings. You need to know where to park. And then when you go to parking lot D, you're going to walk over here. And here's Ethan. Okay, take it away.
All right. Hello. My name is Ethan. I'm the practice manager for Woods Primary and Behavioral Health Center at Hamilton. So as Cindy mentioned, when you come into the hospital complex, you would go all the way to the right of the hospital. That's where parking lot D is. We do have 12 designated parking spots that have our logo on there. You can park in there and then walk your way over to this little entryway that they have here where the courtyard is. So we'll come back in this way.
Okay.
So as I was explaining before, so the hospital is going through a signage revamp, and basically what that means is that there's going to be a lot more signage that's very easily visible, and they're including us in that, which is very important and very crucial, because obviously being in a designated parking spot in the hospital, that can be a little difficult to find, but we're making that a lot easier. So there'll be a couple big signs that have our logo, and then there will be some leadway signs into the hospital where then you'll meet a security officer who will let you in and then guide you to our facility.
Okay. And the Woods logo is like a red heart tilted
correct.
to the side.
Yep.
Yeah.
So it's a red heart. It'll have Woods Primary and Behavioral Health Center Hamilton on it, and then partnered with obviously Robert Wood Johnson Barnabas.
Okay. Great.
So we'll come in this way. So always entering from the Lakefront Tower.
Okay.
So you'll have the beautiful courtyard. Always remember, courtyard to the right, Lakefront Tower. Obviously it's in big bold letters, makes it easy to remember. And then our office is actually the closest to the entrance. So we'll come in this way.
And what did you say about how people that are coming from living facilities are going to the park?
Oh, yeah.
So what's the park that's near here?
So the closest park, and please correct me if I'm wrong, but I believe it's Veterans Park. It is, right? So Veterans Park is right around the corner, but a lot of our residential facilities are actually turning this into an outing, right? So coming to the doctors is not just coming to the doctors, it's going to the park, grabbing lunch, and then stopping at the doctors on the way. They're turning it into a more fun event rather than a stressful event, which is just going to the doctors. And I was telling them, it's really funny, I've been to a few hospitals, this by far is the best food. It's actually very affordable. People laugh, but it's very true.
Good to know.
So we'll come in this way. Obviously, nobody would have to be scanned. This would be manned, so you would be let in. So come on in. So this would be the security station that would be manned.
Okay.
So you would come in through the two doors.
So
You would just
come closer so I could hear you.
yeah. So you would come in through the doors. You would let them know that you're here for us. They would say, "Okay, go ahead." And then there's signs that are down the hallway that you can come find us in. The beauty of Cindy videoing is that you get to see it firsthand. So go ahead. It's very quiet, and that's
I was worried when I went to Cooper recently,
Right.
and that I needed to wear these, and it's not like that here.
well, and you know what? And that was actually something that I think was picked out on purpose. So the beauty
Absolutely.
of the
Yeah,
beauty
I
of this
think so.
Are you
office.
okay if I put you on video?
Absolutely.
Okay,
Yeah.
good. Okay.
Hi, I'm Jen Overfield with Evermore Lifestyle Solution. I'm a self-advocate with autism, and I recognize that this hospital is very sensory friendly for noise.
Yeah. So in our office,
And this is Emily,
Hi,
my
I'm a mom.
friend and autism mom who lives in town. Okay.
And my son, AJ.
We're here for the tour. Okay, go ahead.
All right, yeah, so this was actually picked out specifically because it's in the back area of the hospital, right? So there's not a whole lot going on. A lot of just walkthrough of people trying to get to different rooms, but not a lot of patients themselves, so it is very quiet. So we'll come this way. As you can see, signage on the wall. There'll be a few
There's
more
the
of
Woods
these,
logo.
right? Then we'll come to the right. Another one over here.
Okay. Just showing the place. Okay, so we're gonna head, follow the
So
arrow.
come this
Okay,
way.
here we go.
Following the arrows. And then you just come down here to the right. Obviously, there's no signs here because back there is a restricted area. It's really just food and nutrition.
I can
so-
smell the food.
Right.
It always smells like tater tots.
It does. They actually have great breakfast, including that tater tots. And then as you come down the hall from afar, our sign's right there. You can see it, and we're right to the right. So we'll come on in. So since we're doing a live, we'll do a pre-introduction. So there's a few people who you're going to meet today. There's going to be Luis, who is our Director of Outpatient Services. And then we have Mary Ellen Brogan, who is a Director of Marketing. Diana Armstrong, who will be the Executive Director of the facility. And then Dawn Diamond, who is the CEO of Wood Services.
They're all here?
They're all here.
Oh, okay.
So I'll let you guys in. So come on in. You can see everything.
Okay. Are they gonna be okay with being on video?
They should, yeah.
Hi. I'm doing a live.
That's okay. Welcome. Hello.
Yeah, so we'll do our introductions. I did a brief introduction. So this is Dawn Diamond, CEO of Wood Services.
Hi.
Mary Ellen, you want to introduce yourself?
Hi, I'm Mary Ellen Brogan. I'm the Senior Director of Marketing at Wood System of Care.
All right, and then we have Luis, who is back there,
Hi.
Nice to meet you guys.
and then Dinetta.
Hi, how are you?
Hello.
I'm Dinetta Armstrong.
I'm doing a YouTube live because it's just easier.
Okay, not a
I'm
problem.
trying to explain everything. I'm like, let's just do it.
Okay.
That's okay.
That's right.
Not a problem. So we'll just start, if you guys are okay with just starting from the beginning, we'll start from the
Sure.
beginning, right?
Mhm.
So as you walk in, check out always happens here, right?
Okay.
As we begin, the person who's going to be doing check-in, check-out is me. So my friendly face, hello. I'll be also answering the phone, so anybody who's calling, they're talking to me. So obviously here we have a regular waiting room. You can picture this a little bit different. We're going to have a little bit more sensory equipment in here. We're planning on trying to do something with the TV to make it more sensory integrated. And then over here to the right, we have our pediatric waiting room.
Someone is asking, is this a children's hospital?
So Robert Wood Johnson Hospital is not a designated children's hospital,
What,
no. But
this
this
center?
facility, this center, we serve individuals from the ages 6 and up.
Okay. With special needs?
Yes,
I was going to ask if it was specifically for special needs.
absolutely, absolutely. And their family members.
Medical.
And their
Yes,
family
oh,
members.
and their family
And
members. So
absolutely.
siblings are also.
Yes, they're
Absolutely.
also
Wow.
welcome.
Absolutely.
That's good to
Yes.
know.
Okay,
Right,
noted.
absolutely. So per New Jersey regulation, right, and obviously we serve ages 6 and up, we have to have a pediatric waiting room.
Yes.
But for us, that kind of doubles as a multi-purpose room, and I'll tell you why. Because we obviously address individuals with intellectual disabilities, and sometimes being in a crowded waiting room is not the best spot for them to be, right?
Absolutely.
So if there's a time where we can utilize this additional pediatric waiting room as a just quiet getaway room, then we can absolutely accommodate that, and they don't have to come back out into this room to get to the triage center. There's another door that takes them right in right there,
Oh, that's good.
right? So we can actually come on in.
Yeah, and the census on my counts.
See, and so this
Yeah.
would be perfect.
So it's a little bit smaller. Come on in, come on in. So again, we'll have some sensory items on the wall, on the ground, making it more friendly. And a lot of the stuff that we've called out for a sensory is things that we can hand out, whether they're fidget toys or anything like that. And then the beauty of us opening and touring the public is we're actually able to ask family members what it is that their child needs when they come to the doctor, because we have the luxury of being able to get that and then provide it for when they come. So if anybody's on the live, or if you just send us an email, phone call, hey, I really would like to come here, but my child would really love this. That's great for us to know. We're happy to accommodate that.
That's good.
So we'll come into here. We'll just go right through this door. Come on in. Yeah, no worries.
Go ahead, Ethan.
Yep.
I have it.
So I'll stand over here. So triage center and MA/nursing station. So height and weight taken every time, right? Obviously, and nurses and MAs would be here. But a little fun fact about us, obviously from an integrated care perspective.
I hate scales, just.
That's fine. That's fine. Well, we have more friendlier
mom thing,
ones.
not to-
We have friendlier ones, so that's okay.
Okay.
With
So
lots of scales.
yeah. So you called out, and I want to address it because we're in here, right? So that your child, or was it your child who
Yes.
gets seen at other providers in Robert Wood Johnson?
Yes.
Okay. So we actually will have the option, not the option. We have access to their Epic EHR. So if any information that we need from their visits is through Epic, we can go in and obtain it. And we don't have to sit there and make 1,000 different phone calls to try to get information. We're just going on, we're pulling it, and we're on our merry way. Okay? So we'll come this way. We'll go to exam room 2, which is one of our bigger rooms. But this is really where it gets really interesting and really cool.
Here, let me come on in.
Yeah. Come on in. Don't be shy.
What, I'm noticing the artwork. Are these kids
Yep.
that live at the Woods facility?
So this is actually, Wood System of Care is made up of a whole bunch of affiliates, but you'll see throughout the wall that these are actually individuals who are a part of a few different affiliates, which is really cool because when they come to the doctor, not only are they seeing their face, but they're seeing their friends' faces as well, which makes it a more homier feel.
And comfortable.
And comfortable, exactly.
Do you take Medicaid?
Yes.
Yes.
Yes, indeed.
Absolutely, we
That's
take
gonna-
Medicaid.
yeah.
Yep.
And all of the HMOs or CMOs?
So we're in the process of getting credentialed with them all, but that is our plan, to be able to see all, all payers.
Which ones are you currently with?
So we're working currently Horizon of New Jersey, so
Okay.
we're in the process of, working through that as well as that.
Oh,
And
perfect.
what about United?
United will be part of it as well,
Okay.
yes, so we are getting credentialed with all of those.
What I noticed is that there's no medical bed. My son,
So, that's a good point.
That's a good point.
And we wanna call that out.
Yep,
just as
so
well.
one of the things that's very important, and a lot of people don't really think about it when they go to the doctor, right? Because when you go to your typical primary care doctor, sometimes the actual exam chairs are really, really high. And for our individuals who don't have the ability to take a step up onto
my
that chair,
son hates it.
Yep.
they can just sit on a normal chair, and then if we need to raise them, we can raise them.
Let's give her a ride.
Let's give her a ride,
Yeah,
right?
yeah.
Because I know my son doesn't like the medical bed.
Yeah,
Yeah,
so
and
it's
that's-
the longer typical exam table, right?
And so he always has to sit on a chair,
Mhm.
Right,
and the doctor has to test him there sometimes because.
and obviously, if that needed to be the case and you didn't want to get on this, that would be
It's
fine.
okay.
No,
Right?
you
There's
would
no-
love the
There's
chair.
no,
Will
yeah.
you guys be dimming these lights at all or not really?
Yes, so we are looking at creating more ambient lighting.
Yeah.
Because sometimes people have challenges as far as the bright lighting. So we are looking at providing even some lamps that will create some level of ambiance, and it doesn't have to be as bright as well. So it
Sometimes
depends
they
upon
can
the
even
situation.
hear the fluorescent light too,
Yeah,
the
that's-
high
that's
pitch.
my-
Because of that, right,
I
exactly.
personally have autism and experience a lot of auditory,
Yeah.
so like and
And you can hear that.
see that,
Right.
and seeing that, yep.
Yep,
So
so
that's
that
why I
would-
asked that question.
Yeah.
We'd
That's
be looking
good.
to
Yeah.
adjust,
Yeah.
yep. And then just like a typical exam table, this goes back, I won't put you back unless you want me to.
That's okay.
So very easy, it's on a hydraulic system, so it's not like no jerky movements or anything like that. It does go all the way flat. So
And there's a bottom part that comes out for the legs as well, I see.
There is, and there's a
There's
whole
no
bunch of
stirrups
storage. Yeah.
So in the event that we also needed to do GYN exams or what have you, we have the ability within that chair to extend and recline it all the way back.
So what ages do you serve?
From 6 years of age all the way through adult,
Adult is in how old?
end of life.
Kind of.
Oh, good.
In our world,
Yes,
anyway.
21, yeah.
Yeah, oh, got it, yes,
Yes.
okay, very good.
And
very
then,
good.
so from an accessibility perspective, right, obviously the chair goes up and down, but for individuals who are in wheelchairs who want to get on, obviously we have to think about transferring,
Yes.
right? Some individuals requiring a sliding board, some individuals require a Hoyer lift. We've talked about acquiring a Hoyer lift so that we can accommodate those individuals, which would allow them to be the patients that they want to be. But also from a safety perspective, from our individuals who might just be in regular standard wheelchairs who have to get over, these obviously come out, they slide
Oh,
over so that we can
wow.
use that. That way they're not standing up, it's not a stand pivot, it's more of just an easy transition
Slide
to
over.
and from.
Love it, yeah.
Yep, another thing that is important to call out, obviously we have more friendlier scales,
Oh,
right?
yes.
So nothing where they have to stand on something that's really small, they can just take a step on, we'll get the weight and that's fine. And then the next thing would be, obviously, because we're a practice that specializes in meeting individuals where they're at, everything from our facility should be mobile. So you'll find blood pressure cuffs, these fancy things. Everything has the ability to go with the patient
I like
and not
that.
limit them from being just
Yes.
inside this room.
Right.
And what we've called out is that in the rare occasions that an individual needs to have vitals taken in the car, we're gonna accommodate that because we gotta meet them where they're at. And it's about having the visit, not where the visit is, right? Okay, so we'll keep going.
So which type of doctors are we talking about here? This is just this primary?
So this would, yep, so this is going to be, the practice is for primary and behavioral health, right? So primary care doctors, and then starting day one, we'll have medication management done by a psychiatric nurse practitioner.
Do you have designated psychiatrists and physicians for like each office?
So we're starting off on a little bit of a. Go ahead.
So we will have a primary care provider, which will be a physician, in addition to a nurse practitioner.
Right.
These individuals will be dedicated to providing services right here on site. So we will be available Monday through Friday. As Ethan called out, in addition to the physician and a nurse practitioner who are primary care focused, we will have a psychiatric nurse practitioner. And then we will be able to also handle the medication management concerns that will come up, do psych evals and things of that nature.
Right. Okay. Thank you.
Okay. Great. So we'll come out this way.
Stephen is asking what hospital this is. It's Robert Wood Johnson down in Hamilton, New Jersey.
Yep.
It's a brand new center that they're opening for special needs, the Woods Center.
So
Everybody notice the difference in the chair.
yeah. So yeah, this is a
that's
great
the difference,
example.
yep.
Right? Big difference, right? Chair sits a lot higher.
Oh, yeah.
Obviously, we have the step for them to get onto so that they can be a little bit easier. But overall, 6 exam rooms. They're all laid out the same way. You'll find that a couple exam rooms are a little bit smaller, but if we don't have to use the small ones, we'll use the big ones, right?
Right, if someone has a larger wheelchair, it gives, or if they're coming with several people, our larger rooms will give you the ability to accommodate more. So if a family member wants to come, God bless you, their caregiver or whomever, our larger rooms will be able to accommodate all of that.
Absolutely. So we'll come in this way. And speaking of wheelchairs, that brings us to our next little spot, right?
Oh, yeah.
So a lot of our individuals have called out that if they're in wheelchairs, it's hard to obtain. Oh yeah, there's more pictures.
Yes.
More pictures.
Yeah, there you go.
Yeah.
I like that one. That one's cute.
There was one inside too. That was
Did you
nice.
see that?
Every exam room.
Every exam room has
What
one.
exact populations do you service?
So individuals.
IDD, autism, traumatic brain injury, neurodivergent individuals, so the full gamut of individuals.
What
who
about
can-
Alzheimer's and dementia?
Alzheimer's, dementia.
Okay, awesome.
Well, we can manage individuals in that regard, but we would work with specialists in the event to manage through those pieces.
Okay,
Yeah.
awesome.
Yeah. Okay, so we'll come this way. So as I was mentioning, so a lot of our individuals in wheelchairs have called out that when they go to the doctor, it's hard for the doctor to actually get their exact weight. So we have obviously taken note of that, and we have went out and got a wheelchair accessible scale.
Nice.
And for this, there's somebody at the front who needs to get picked up, just so that you know.
Okay,
Yep, at security.
and security?
Yep.
Got it.
So, fun fact, right? A lot of families may know this, some may not. So every wheelchair, per regulation when they're built, and not all of them have it, right? But they're supposed to have the weight listed onto their wheelchair. So by us being able to look at that, we can then take the exact weight, because obviously we can get the weight with them in the wheelchair, but then subtract the weight of the wheelchair and get the exact weight of the individual, which can be hard to do for some practices who don't have that. And that obviously folds down for those who want to see. But we'll come this way, we'll go into the lab. So another thing that is important to call out is for individuals who have disabilities, going to Quest and LabCorp to get their labs drawn with individuals who are not familiar with the population can be very difficult.
Yeah, absolutely.
Right. So, and we are going to be doing those lab draws here. So they're working with individuals who are, very familiar with the population, but all of the lab draws, all the lab work is actually still getting sent to Quest and LabCorp. Those contracts have been established.
So it's still taking Medicaid, not out of pocket.
Correct.
Okay.
Yes.
Awesome.
Correct.
Because I was on Medicaid when I was younger. I would, even with LabCorp and stuff out of offices, I would still get slammed with bills. So that's why it was my question.
Yes, so we
Yeah.
will provide your insurance information to LabCorp,
Okay.
and then they will bill according to the Medicaid guidelines.
Awesome.
Right.
Thank you.
Right.
Yeah.
Yeah.
All right.
The other piece, call out point of care testing. So there are some, while while Ethan called out that we will send out certain labs, there will be some labs that can be done here on site. So for instance, for flu, COVID, RSV, we have the ability to do testing on site, and then we will know immediately if your individual has that particular, virus or what have you, and then we'll be able to implement a plan of care for that person right away.
Right away.
Yeah.
So then we'll come back down this way.
So what's great is that you're not waiting at LabCorp in that big waiting room.
That's right.
That's
Right.
That's right.
And then it's just
You're
come
just,
in
it's
here.
a one-stop shop.
Yeah,
It's a
I know
one-stop
that.
shop. So just a couple offices here, this would be providers' offices. But then the other big room that we're gonna show you is this one. So this is a group multi-purpose room. So as 2026 comes and we obtain our behavioral health license, with that comes therapy services. And we'll be able to accommodate group therapy, right? So which is obviously important. But another thing that a lot of people forget is if an individual needs to come for an admission physical or a discharge physical from a residential facility, and everybody has to be a part of the appointment, sometimes that involves bringing a lot of people who are a part of their care so that the physician or the nurse practitioner knows exactly what's going on. And we can accommodate that in this room with the space. So we'll come on in here. So again, that's why we call it a multi-purpose room. It can really be anything, including, and as we talked about before, for the individuals who can't stay in one room, obviously because it's a doctor's office, hustle and bustle happens, right? So if this could be a little additional space where we could obtain vitals, put them in a quieter area, kind of somewhat isolated from the other rooms, that's fine. We'll accommodate that, no issues. Okay?
Sounds good.
Alrighty, any questions in this room? No? No? Good? Solid? Right. Cool.
Great.
So come down to the back. Okay.
They also have adult partials, they have an array of services, but we have three.
So, again, so this is an example of a little bit of a smaller room, laid out the same way. Obviously, same services provided. The exam chair is that tall one, obviously with the step that comes out, but all the exam rooms will be laid out the same way, except the one in exam room 6, and I'll explain why. Yep, get the
Now,
pictures.
you, in the other room, you had mentioned a gyno exam. I know that they do that in the other facility. Will they do that here for females?
You want to answer
I didn't
that?
hear the question.
Yeah.
I'm
So
sorry.
you do gyno exams here?
Yes, we will have the ability to do GYN exams as well.
Do you have gynecologists to do that, or is it just this?
So primary care providers have the ability to do that.
do? Okay.
Yes. Mm-hmm.
Okay.
So yeah, we're everywhere.
And then, we do it here. We do it actually over in our Langhorne location as well currently.
Yeah, I know you do them over there.
yeah.
Yeah.
Alleys, archways,
We'll come down to exam room 6. This is the it's like the Imagine room, right? You got to picture it a little bit of a different way, and we'll explain why. Yeah, get the pictures. Really cool. Get the pictures. Fun.
Look at the faces,
Cute.
right?
I know, so cute.
Chilling out.
Yep, chilling on the beanbag chair. Yep, okay.
Okay, so this is going to be the designated medication management or psychiatric room, right? So it looks like a typical doctor's office room, but I want you to imagine it in a little bit of a different way. So as was called out before, lights would be dimmed. We'll have lamps. It'll be a little bit more homier. We'll have an actual sofa in here that makes it a bit more homier. And anything that doesn't need to be in here for a psychiatric visit, we don't have to have in here. So, like, if that doesn't have to be
Yeah,
in
like
here,
the
Yeah,
couch,
pull
for
out,
sure,
right,
yeah.
yeah.
You just want to make it warm and
warmer
inviting.
and then more inviting. But yeah, so psychiatric
Well,
evals.
so you know what I do for a living? I'm a paint color consultant,
Really?
and so
Okay.
I'm looking at these rooms saying, we need a little color.
Okay.
That's
Do
just
you
my
think
that's
this-
just my preference. Just for certain rooms, like the
okay.
hangout room
Yeah.
over there,
Sure.
feels a little sterile.
Okay.
And this one too, I feel like if you want a relaxing vibe, I think the maybe even making this wall even a little darker and lamps just so it feels a
Right,
little
to
more
make it more
cozy.
cozy. Right.
Make it
Yep.
feel more like a
Yep.
family room,
Exactly.
like instead of a
That's
hospital
right.
vibe.
That's a great call out. That's something that we can definitely discuss.
Right. The lamp's coming, so.
The lamp's
keep
coming.
it-
Yeah, I know, I know.
Some more
To me,
warm
it's the
stuff
two
in.
waiting. It's not the original waiting room, but the other one that you brought us into.
Yeah.
It's
Oh,
the
the
second
pediatric
one.
The pediatric wing.
Yeah, like I
Okay.
would put a little color in there, and that room at the end of the hall that
Sure.
we were just in, just one wall,
Okay.
one accent wall of some color.
Sure.
We can,
Yeah, it makes
Yeah,
sense.
that's fine.
Yeah.
That's fine.
Because the colors jumping out at me on the pictures, like that one over there, they're all wearing like these turquoise colored shirts,
Right.
and I would do the whole wall that color.
Mm,
That's
okay.
just me.
That's
That's
great. That's
just-
great feedback. Great. No, great feedback.
That's just what I see when I go to a place.
Yeah,
I
yeah,
zone
yeah.
right in on the paint colors. Okay,
Yeah,
let's
great.
go.
So that's it for the exam rooms and the facilities. Any questions that we can answer for you? No? Everything okay?
Oh, I have a question.
Yeah.
Alright, so in order to come to your facility,
Yes.
does my son need like a script, or since we already with RWJ, does that, how do we go about that?
So you would,
Like if I wanna, let's say, change my primary.
yes, so
Because
you,
my primary is not with RWJ. I
Right.
want everything with RWJ, so how do I do that?
and that's fine. So you would have the ability with your insurance company to call and say that you would now like to start going to Woods Primary Care and Behavioral Health Center at Hamilton, and you would be connected. So you do not need a referral of sort to come to your primary care. You get to choose who you want as your primary care provider. And to Ethan's point earlier, because you want to stay within RWJ, the benefit of having the joint venture is that we are with RWJ and we will be able to access their records. So if they happen to go to a specialist, we can pull it right up through the Epic system, and our providers will be able to review what's been going on, so we can allow for that level of care coordination.
Love that, and I have another question. So, my son was seeing a behavioral therapist in the past, but it's a long waiting list for behavioral therapy. Are you guys gonna provide that as well?
Yes, and I think I heard you speak to
Yeah,
that.
so
There's a long wait list.
Yes, it is. Behavioral health is certainly very long, and so we are looking to be responsive to that. And so we are planning to apply for integrated care for both primary care as well as behavioral health, and we're looking to provide therapy. We're hoping that it will be put in place by 26. So there will be a little bit of a waiting time as far as the therapy services are concerned, but if you're interested, just as well, you
I'll
know.
give you my name.
Right.
Get on the wait list now.
Right, exactly.
Yeah.
Yep.
Great. Awesome. Anything else? Any questions from you? No. How about you, Cindy? Anybody from you two? Any questions?
Oh, yeah, any questions
No.
there?
No, I'm
questions
not seeing
from
any.
Okay.
Cindy, this is great.
Great. This is
Thank you.
great. What do you guys think?
We love them. I love
Yeah?
them.
Nice.
Yeah, it was a great call out for the walls. That's really helpful. Anything else that you caught?
Just
Cindy?
because I personally get anxiety going to any kind of doctors
Yeah.
myself,
Yeah.
so anything that helps the vibe feel less hospital-y, doctor roomy,
Sure.
Yeah.
the better. I mean, I like these chairs because they're kind of like big lounge chairs, you know, like kind
As
of like
opposed
big
to-
recliners.
Yeah.
Yeah.
But I do like the idea with the colors.
Yeah.
Yep. That's a good call out.
And we're balancing that.
You don't want it to be too clinical.
Right, you don't want it to
Like
be too clinical, but you don't want it to create too much of a stir, right?
Mhm.
Yeah, so,
Right.
I like that.
Like
Turquoise is
warm-
my
warm
favorite color.
colors.
so.
Yes, well, it's the ocean, it's the
Right,
beach,
right, right.
that's
Nice
why.
and
That's always
warm.
gonna be
Right, right,
relaxing,
right.
yeah.
Right.
Mhm.
Well, awesome.
Okay.
So then we'll head up to the front then.
Yeah, this is great.
These guys are having a whole conversation out here.
I know.
Oh, I have another question.
Yeah, absolutely.
What about Saturdays, Sundays? The doctors are available, because that's one thing. My primary, I have her personal number. So let's say Saturday, my son has a fever. I don't want to take him to emergency.
Right, right.
I call her up.
Yep.
And she just sends me a script or whatever, so she's available.
Yep, so we will have after hours availability in terms of, we'll have a telephone number that you could call, similar to what's going on currently for you. We will have a provider who's on call 24/7.
That's good to
So, yep, so whether it's Saturday or Sunday, after hours in the evening, someone will pick up the call and they'll triage it to the provider, and then the provider will give you a call back.
And Emily, when I interviewed Dr. Kolesk, who's gonna be
Yep.
running this,
Yep.
he does house calls.
Oh my God, that's amazing.
Yeah, I was like, what?
What? Yeah.
What? Who
That
does
already-
that
Yeah, it
anymore?
doesn't.
Yeah.
Yeah,
Yeah.
that's good to know.
Great.
Yeah, for emergency hospital, so she is available.
So yeah, I came out.
Sorry, I didn't mean to like
No, don't be silly. No, I appreciate it.
All right, what'd I miss?
We were talking about all the services that Woods does under different names, Legacy Treatment Centers, Allies, and
Archway.
Archway, and didn't know all of that because I asked if they were. I thought they were only in PA.
We
So
also
just
have
learning
the
all
joint
that.
venture with Penn Dental in the Langhorne location. So, and that's a clinic that's specifically dedicated to individuals with special needs and their families. So it's another resource, so we'll have you come out and
Absolutely.
take a look.
Wait, did you say dental?
Dental,
Yeah.
Oh,
yes.
yeah.
It's
You know
huge.
where I go? I go to Newark.
That's what she just said.
As a
Yes.
adaptive dental.
Brilliant smile.
Oh, that's
Oh,
yes.
wow.
There's different
So-
ones
Yeah,
that.
because we did the dental hopping, no one had patience for my son. One dentist said, "Oh, let's strap him in," and they strapped him
Oh
in.
boy.
Yeah, no.
And I
We
was
have to
like,
have you, we'll have you both out to
Yes.
meet with Dr. Henshaw and the team over at Penn Dental.
Would love
also.
to have
Yeah.
you there.
We
It's
found
a
someone in
great
Newark.
clinic.
He's happy, but it's so far.
Yeah, that's quite the far with the traffic up north and the overstimulation with the North Jersey. No, I love North Jersey, don't get me wrong.
Right,
I hate it here. But
But it is
overstimulation with it,
different.
yes. Cindy, you like,
Well, I will tell you that the reason, the way that I found Dawn was through Stacy, who's on my team for the retreats, and she brings her son Louis down there
Yes.
to go to the dentist, and he loves it. And
Yes.
she just went on and on and on. She's like, "You gotta go see this place. Like Louis loves it, and it's a beautiful ride. It's like all through farmland."
Yes.
And Louis loves
Yes.
taking her an hour-long
The
ride in the
horses,
car.
yes.
Yeah, yeah.
And then
yeah.
we have horses and alpacas and pigs too. So
oh
then
wow,
you
I
can make
love
it
that.
look-
Where's, in which location?
That's
This is
all
the
in
Hampton
Langhorne.
Langhorne.
So
Oh,
we'll
I
have you
really
come
want
out
to
for
go.
a
I
visit.
really want to go visit there.
Okay.
Yeah, the animals part for me. I'm like, yes, that's my favorite.
Yeah, yeah.
And when you're there, Dinetta can show you our clinic there.
Yeah.
The reason we opened this clinic was to be accessible for families, here in New Jersey and New Jersey Medicaid. The Penn Dental Clinic in PA does accept straight New Jersey Medicaid. It gets a little bit more intricate when you have a secondary insurance, and they do accept some, and they work with families to try to, figure that out.
Yeah.
Do you also accept Medicare and VA benefits or no? For this facility?
Not VA benefits, but we are planning Medicare.
Medicare?
Mhm.
Planning or like it will, like, you will have it? Or?
Yes,
Okay,
yes,
awesome.
yes, for sure, but not VA. VA's a little bit more tricky to get into. We've explored that, but
If you have connections with that.
yeah, we're trying to.
I do.
Oh, you do?
Yeah.
Okay, great.
I was explaining how that we're one service is under Kevin Herman, which is Town Square Senior Helpers that specializes in Alzheimer's and dementia care. That's blended care, taking payment through VA, private pay as well as Medicare payment, and then we have the second side, which is blended care with quality programming led by me as a self-advocate and some other moms, providing individualized programming in our locations as well as one-on-one support through Golden Heart Advocacy under one umbrella. And we work closely with physicians in trying to provide good places for referrals for our families.
Okay, great. That's
Yeah.
wonderful. Great.
Yeah, and definitely this year, Cindy, we were talking before, when get on your calendar to come to your conference, and really, I think we can bring the broader team that covers the whole scope of services here in New Jersey for families, because we really are cradle to grave with all of our New Jersey affiliates as well, and then add that Penn Dental partnership in PA that serves New Jersey families. It's a one-stop shop. So.
That is so important. That's what I talked to Dr. Kolesk about when I interviewed him about how I like a ping pong ball with Robbie, like going to all the different people.
Yes.
Yeah.
And one doctor wanted to do surgery on his feet, then I took him to a different one. He's like, he doesn't need surgery. Of course he wants to do surgery. He's a surgeon. He doesn't need surgery. I'm like, can you guys just talk to each
I think
other?
Yeah.
what I love about
please?
that is that it's all
Coordination
under
of
one
care is
healthcare system
Yeah.
than
Yes.
like electronic system,
Yeah.
and then
Right.
every doctor has access to everything, which is great.
Right.
Love that.
All right, I'm gonna sign out here.
All righty.
Okay, that's your tour.
Bye, everybody.
Should we give a number?
Oh, yeah. Go ahead.
The
Give
number?
the contact info.
Yeah, so 888-628-9661, and then when you call, you'll get me.
And we're located at 1.
1 Hamilton Health Place, Hamilton, New Jersey, 08690, 08698. Parking lot D, parking lot D.
Yes.
Yeah.
And we're about 20 minutes from Princeton here.
Plainsboro.
Plain-
I don't know how far from Princeton, but
Alright.
Princeton maybe.
Princeton's about another 20 minutes. It's not far at all.
Okay.
All right, so we're further south than that.
A little bit, yes. A little
Okay, just so people
South
know.
of Trenton.
bit. South of
South of,
Trenton.
yeah, south of Trenton. There you go. That's all I need to know. Okay, everybody.
All
see you
right,
later.
thank you.